Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Ballman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo Outpatient Program. Thanks for joining us today. We're talking about what is an eating disorder. So let's begin and open the conversation here. What are the different types of eating disorders?
Well, eating disorders can include anorexia, which is also a restrictive eating disorder. It can include binge eating, and it can include bulimia. So it's a fairly broad category, and sometimes it can cross over. Someone who has anorexia may also sort of turn into someone who has bulimia. It can flip back and forth as well.
And these are disorders that typically arise in young adulthood, sometimes in high school or college years. They are more common in women than in men. And they are often puzzling to people. Why would somebody not eat healthy foods? But it becomes a kind of disorder that can become very deep-rooted and very difficult to treat.
What are the symptoms of what we call restrictive ED or anorexia?
Well, that is severely restricting your food intake. And ironically, the person with anorexia may be very interested in food. They may prepare elaborate meals for their family, but then they'll put 1 teaspoon of something on their plate and sort of move it around. So food is a very prominent part of their life, but they're very dependent on controlling their intake. It's all about the control of that.
And individuals will paradoxically often perceive themselves as fat. So it's clear that they've lost a lot of weight. Their BMI may be down around 15. They may even be in medical danger from how much weight they've lost. But if you talk to them, they'll be focused on how they perceive themselves as fat.
Yes, they have this body image issue that it's almost bordering on a delusion, because you can sit there and look at them and they look quite thin, but they don't see. That's not who they see in the mirror.
What are the symptoms of binge eating or bulimia?
Let's start with bulimia. Bulimia is the disorder which includes episodes of binge eating, and I mean eating a lot, followed by some way to binge, to get rid of that food, either by self-inducing vomiting, by taking laxatives, even exercising to the point of exhaustion just to burn off calories.
So it's a disorder of extremes in the sense that, on the one hand, there's extreme overeating and a sense of being out of control with the overeating, and then consequently a focus on how to get rid of the food that you've eaten, either through vomiting or through laxatives or through other means.
Sure. What causes eating disorders?
To some degree, they're inherited. So there is a genetic influence with eating disorders. There also seem to be psychosocial and psychological causes of eating disorders. So for instance, sometimes there's a sense for the individual that they've really lost control of things in their lives, and they focus getting control over their eating.
And certainly in a culture that puts such emphasis on weight, particularly on women's weight, it really can push that disorder to the forefront. And we see it quite a bit, in fact, in high schools, particularly late high school age girls, and certainly college girls.
Sure. What is the treatment for eating disorders?
The treatment for eating disorders involves several facets, including a very specific eating disorder specialist, and I can't emphasize this enough. You must have someone who's really a specialist in eating disorders, or even going and attending an eating disorder program, which includes an intensive outpatient program.
And some of the focus is on developing habits around eating in very concrete ways that lead people to begin to eat in a healthy way again. Other aspects of the program involve bringing families in and helping the family dynamics between that individual and the family they live in.
Got about 20 seconds. Can someone with an eating disorder get better?
Oh, yes, certainly. Again, it's a matter of reaching out, and again, often in this case, others encouraging someone, saying you need to get treatment. And again, this disorder is very serious. This disorder is life-threatening.
And it's important to reach out to the person. The person with the eating disorder will sometimes take the attitude of they're fat. There's no need to worry about their eating. So it's very important to say, no, there really is a problem here and we need to get you some help.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss recovering from a mental illness.